So yes, the uterus is healthier pregnant than non-pregnant because you protected it against the influence of progesterone by having the pregnancy. And we do see resorption sites in the uterus at C-sections. You can't really identify them as well if you've just, like if you've done an ultrasound and there were 6 puppies on ultrasound and then you had 4 born, then you would be suspicious that there were either miscounted puppies or resorptions. And sometimes you can see resorptions on ultrasound pretty effectively, and sometimes you're just not really sure if you saw a resorption. But at C-section, we can see them. And so when we do C-sections on bitches that have had a pregnancy that didn't lead to the full number of puppies being born, then we're recommending to our clients that we biopsy that uterus at the C-section. So we can take a uterine biopsy where the incision site for the placenta was, and then we'll take a biopsy at the resorption site. And we use a pathologist that's double-boarded in theriogenology and pathology, so he's putting together more and more data to try and figure out what kind of changes we see. Is it fibrosis, scar tissue? Is it cystic endometrial hyperplasia? Was there an infection, some neutrophilic infiltration that tells us there was an infection? We've had one case where there was like an allergic reaction to the sperm, and so we saw inflammatory changes that were suggestive of that. So there's a variety of different things that you can see that are kind of interesting in trying to figure out what the underlying cause was, which isn't going to help you much if you're not going to breed that female again. But if you're going to breed her again, or you're breeding her daughter, then knowing that information I think is really helpful, because then we can address some of those things prior to the pregnancy and after the pregnancy. We've got a dog I saw a client that's here right now, that we had multiple breedings unsuccessfully. So we did go in and biopsy her uterus, and we came back with inflammatory changes. So we put her on prednisone, and I don't routinely use prednisone for this, only if we know that there was some suspicion of a problem. So we put her on prednisone, and she ended up having 7 puppies in her next breeding. So she bred her 3 times with 0 puppies. So we went from 0 puppies to 7 puppies with an appropriate course of prednisone prior to the breeding. You don't want to have them on prednisone during the pregnancy. So there's a lot of information we can glean, and that's one of the things that I did that research, that why we did those biopsies, and why Emmanuel Fontaine from France had put together that data, as he published the paper on that.
Mm-hmm.
And then the pathologist that's doing the work right now at Ohio is trying to put together a study of what normal uteruses look like. So we're going to be starting to collect uterine tissue at C-sections. We wouldn't go to surgery for no reason, but we would go in, and as long as we've made an incision in the uterus, collect some of the uterine tissue, because you can just make the incision just a wee bit wider and take a little slip of tissue that won't impact the bitch's future fertility. And by doing that, he can start looking at hundreds of what normal uteruses look like, because you can't identify abnormal until you identify normal, and there just isn't a lot of data on that yet. So he'll be looking at that. So there's some good stuff coming. I think it'll be interesting. Yeah.